Hi, this is Dr. Mark Trolice, the Director of Fertility Care here in Orlando, Florida. And I wanted to talk about one of the more difficult decisions we have to make in vitro fertilization, and that has to do with how many embryos to transfer. It's one of the most common questions that we get, and one that we spend the most time on. The decision on transferring embryos is a very important one because it's a fine balance to maximize the pregnancy rate, but also to minimize the multiple pregnancy rate. And over the years, as our laboratories have increased in their capabilities of growing embryos and maintaining good quality embryos, we have been seeing a reduction in the multiple pregnancy rate due to a reduction in the number of embryos transferred. At the same time, we're seeing better pregnancy rates. So what that means is that we all have to feel comfortable in transferring less embryos because we're seeing good pregnancy rates, and the less embryos we transfer, the less risk of multiple pregnancy. Why are we concerned about multiple pregnancy? After all, many of our patients come in to say, I would love to have twins. Well, that's a problem because twins is a high-risk pregnancy, and that leads to complications in pregnancy, specifically increasing risks of miscarriage, preterm labor and delivery, so low birth weight, risks of respiratory and neurologic problems, even problems at delivery in terms of severe handicap and even, God forbid, death. So twins is not the goal. It is a complication, and certainly triplets and higher should be extremely avoided at all costs by reducing the numbers of embryos, because that's even a much more complication in pregnancy. So how do we avoid multiple gestation or multiple pregnancy? And we do this by reducing the number of embryos. So what do we use as a guide for that? Well, it's based on several factors: the patient's age, the day of embryo development, and the appearance of the embryos, as well as how many embryos we have to freeze. So we're going to include, in providing you information on the Society of Assisted Reproductive Technology guidelines, and that's what we adhere to try to reduce the risk of multiple births. Additionally, the reason why we reduce the number of embryos transferring is to reduce pregnancy complications to you, but we want to obviously maximize the pregnancy rate. The other point to mention is that as a woman ages, they are more likely to have chromosomally abnormal embryos. As a result, the guidelines do allow for more embryos to transfer as a woman ages. Now, there's two types of embryo transfers. In other words, two times in the IVF cycle. One of them is on day 2 and day 3 of embryo development, and that's called the cleavage stage. The other is on day 5 of embryo development, or the blastocyst stage. Now, in nature, day 5 is when the embryo actually is implanting into the uterus. So it's more physiologic and more natural to transfer blastocyst embryos. The age-old question that will never be answered is that if we grow all of our embryos to day 5, and if, God forbid, there's no embryos developed, would it have resulted in a pregnancy if we transferred it on day 3? Well, that will be argued forever because it's an unanswerable question. But science and research are leaning more toward the blastocyst embryo transfer, day 5, and growing all patients' embryos to day 5. And what that does is it really selects out the better embryos, the ones with less likely chromosomal abnormalities, and the ones most likely to implant. So what we're doing in our practice is strongly advising all women less than age 35 on day 5 of embryo development to transfer a single embryo. Transfer guidelines are the same whether it's for fresh or frozen cycles. So, single embryo transfer for all women less than 35, a strongly encouraged single embryo transfer for women 35 to 37, and then we judiciously follow the guidelines for all women above 37. So I hope that makes it a little bit more clear on how to select the number of embryos to transfer, and we're always available for questions that you have, and wish you tremendous success in your IVF cycle. Take care.